All right, we are joined by Dr. Will Naracci today. Will is a primary care physician focusing on partnering with his patients to address their overall health concerns and their goals in an environment of trust and safety, which we're going to talk a lot about today. He's very passionate about resolving healthcare inequities and working with his patients to help them make the best decisions possible. He's a queer physician, and his main focus is providing LGBTQ centered primary care that's passionate, collaborative, and sensitive to that population. Also, an osteopathic physician, which I think we're going to dive into a little bit. So, he brings that expertise and tries to help people understand how to get the body to inherently heal itself. Will, thank you so much for joining us.
Yeah, thanks, Jesse. Glad to be here.
Yeah, so there's a lot to dive into there. I'm really excited to talk about this, but we're physical therapists that love to help people exercise. So, I always like to start asking if you could only do one form of exercise for the rest of your life, what would it be?
I'm from Colorado, so I have to say hiking would be
Okay.
my
As soon as you said from Colorado, I didn't know if you were going to say hiking or climbing, so
Yeah.
I knew it was going to be one of the two.
Yep, hiking.
Great. All right. So I think we dove into this a little bit in your bio, but tell us, being a primary care provider, primary care physician, who's the type of person you'd like to help the most?
I mean, my passion is definitely working with LGBTQ patients. That's the focus of my practice for the most part, but I do see patients from all walks of life. And generally, I just really want people to feel comfortable talking with their provider, being able to bring up their concerns and fears, and then working together to figure out, what's going on or what do they need to best take care of themselves. So.
That's great. So, as an osteopathic physician, I think a lot of times I have clients who don't totally understand what that means.
Sure.
So, in short, can you summarize your entire schooling?
Yeah, easy. So I went to osteopathic medical school in Des Moines, Iowa. Osteopathy is basically the same training as traditional medical school, but we also get extra training in the musculoskeletal system. And so there's a lot of things that branch off of that, but one of the tenets of osteopathic medicine is really focusing on the body's ability to kind of align and heal itself. So I don't personally do the osteopathic manipulation techniques that we learned in school, but it's generally just an overall focus on looking at the patient as a whole person rather than just separate systems like cardiology or nephrology or whatever. So yeah.
Yeah, I love that because I think too often people go into a healthcare provider, and whether it's a physical therapist, whether it's a chiropractor, whether it's a primary care physician, and unfortunately they only get looked at for their shoulder or
Right.
only get looked at for their GI issue. And there's
Right.
this whole ecosystem that we kind of need to take into account.
Right.
And so I love that approach.
Yeah. Yeah, that's exactly the idea behind it is obviously paying attention to separate systems, but then thinking about the way that they all connect, and then also looking at the patient and the specific challenges that they're facing and how that integrates with their health. So,
Yeah. So I know one of your passions is the LGBTQ population. So what's a recent success story, or what's one of the most rewarding moments you've had in your career when it comes to addressing those inequalities or just working with that underserved population?
yeah, I mean, my passion is definitely for my transgender patients. I do a lot of hormone therapy and gender affirming care and partnering with those patients during their transition and then afterwards has been truly one of the greatest rewards that I think I've ever experienced in medicine. So, helping people actualize who they are and be themselves is really a big part of why I continue to do what I do.
That's great. So how do you think you're able to help that population where they're not being served or helped elsewhere?
I think being a queer physician and just being part of the community here in DC, there's just a shared empathy, but also a shared experience that you have with your patients. And even though I'm not trans or lesbian, we're all united by the queer experience and what that means. So, and then having been in DC for 11 years now, I feel like I've gotten to be a really part of the community, which I really enjoy. And I think that just taking that experience and then combining it with knowledge of health really helps those patients to feel heard and seen.
Yeah, I mean, no matter what healthcare provider you go to, you want to feel seen and heard.
Mhm.
And I just think that's so important.
Yeah.
So, what do you think is even know how to word this question properly, but what do you think is the biggest missing piece in that population feeling seen and heard in most healthcare environments?
I think, unfortunately, there's a lot of discomfort for providers who don't identify as LGBTQ, and it's not necessarily based in bias or homophobia or transphobia, but sometimes I've had a lot of patients say that their conversations with providers can just be really awkward, or they don't feel like they can be truly themselves or truly honest about different challenges they're facing. And I think that's why a lot of people look for someone who kind of reflects their own struggles so that they feel like they can be better understood.
Yeah, and being understood. I mean, there's so much research that shows, whether it's race or gender or sexuality, if you're not understood by your provider, that's where mistakes happen and just getting much worse care if they're not being understood. So while most people watching this are probably more on the patient side, if there's a healthcare provider watching this, what's something us as healthcare providers can do to make people feel more seen, make people feel more understood, and just make those conversations more comfortable for the patient?
I think, it seems obvious, but just going in with an open mind and listening to patients, a lot of the times patients will tell us what they need in some respect. Even if all they're doing is talking about symptoms, we can gather so much from what they're talking about to figure out what's the best path forward for them. But I think really just going in with an open mind and with the empathy of knowing, hey, this person may have had a bad experience with a healthcare provider in the past. How can I be as welcoming and affirming as possible for them? And I think that patients understand, like, not every provider that they see is going to be queer, but there's just that kind of general humanity that we can all share that I think makes people feel comfortable. So yeah, I think just being open-minded and listening.
Yeah, and I mean that's just part of being a healthcare provider is we should be open-minded and we should be listening no matter who comes in that's looking for our help. So I think it almost sounds too simple, but sometimes in being a healthcare provider, it's easy to get caught up in your day and you don't necessarily always take the time to reflect on, am I listening? So I
Yeah,
think it sounds simple to just listen and be open-minded, but I couldn't agree more that I just think it's so important that no matter who's coming in to see us, that's something that we always have to keep in mind.
yeah, I agree.
And then from the patient side, let's say they've had one of these experiences. Is there anything that they can do to kind of empower their own treatment more? Or it would be great if we all saw providers that totally understood and totally heard us, but maybe we're not in an area that there is a provider like that. So is there anything patients can do to kind of be more empowered in their
Yeah.
experiences?
I think some of the most helpful conversations I've had with patients have been when they've shared their bad experiences with healthcare in the past and when they've been honest and upfront and said, hey, my last doctor did XYZ, or I went to this specialist and I felt judged by them. That tells me where they're at and what their fears are surrounding their health and their fears around not being heard. So I think patients absolutely have the right and hopefully feel empowered enough to say if they've had a bad experience in the past so that that provider can almost be hypersensitive to how they treat that person and showing them, hey, I'm here to care for you, I'm here to listen to you, and I want to make sure that we don't repeat the experience that you've had in the past.
I've had that before myself where someone will say, I had this experience and I hated how it made me feel. And I would agree. It just makes me more aware of, okay, that's what this person's experience was. I need to now make sure that their experience is not that here.
Yeah,
Because no matter what that experience was, I just don't want them to ever feel like that again. So
yeah,
I think that's great. So if you've had a bad experience somewhere, go to your next provider and explain what the experience was, why you didn't like it, and that honestly, just even telling them that, you're probably going to get a lot of information of how that provider responds to you. Of are they going to be the right person? If they don't
exactly.
respond how you want them to, it might be an immediate sign that nah, this one's not for me either.
Yeah, exactly. If someone responds defensively to you sharing, a past experience with a provider, then it's probably not a good fit. So,
I would agree. So I know you also treat a lot of pelvic floor issues. So I think there's both between the LGBTQ population, also pelvic floor. There's a ton of fusion, misinformation, just lack of knowledge. So, what's one of the biggest misconceptions or biggest health myths that you think is helpful for people to understand with your practice?
I think that there is sort of this perception that pelvic floor health is solely a cis women's issue and that men can't or don't struggle with those issues as well. And when I look at a lot of the conditions I treat, like erectile dysfunction or just chronic pelvic pain or even discomfort during receptive anal sex, a lot of men in particular think, well, this must just be how it is, and they don't really realize that there are tools that we can use to help them. So I think that's one big misconception is just that it's been kind of siloed into a gynecological realm when really there's a huge array of patients that can struggle with pelvic floor health issues.
Yeah, we see it all the time too, because we see a lot of that as well with our providers. And I think I would agree. Again, almost sounds too simple and too broad, but I think one of the biggest myths that out there is just not an understanding that like you said, like other people besides cis women can have pelvic floor issues. And 99% of people that come in here, they started their journey with, I didn't even know this could be a problem or could
Yeah.
be fixed.
Yeah, exactly. And I'm also kind of shocked sometimes at how few specialists who deal with issues in that area don't think about pelvic floor PT as a management option afterwards. So people will have hemorrhoid surgery or they have chronic prostate inflammation or frequent UTIs or all kinds of different conditions, and it seems like a lot of people just never even suggest pelvic floor PT. And I've had so many patients where I kind of put that bug in their ear and they're like, oh, that actually sounds like something that could really help. So, yeah. So.
I've talked to multiple primary care physicians that even they said, oh, I didn't know male pelvic floor was a thing.
Which, everybody's learning and it's a,
We all have to start, we all have to
yeah,
start
we all
somewhere,
have
right?
to. But yeah, it's a really important tool that a lot of my patients have benefited from. So.
So how might someone know what issues might they be dealing with, or how might someone know that they even could benefit from pelvic floor therapy if it hasn't been suggested to them from their provider?
Yeah, I think the more common conditions, the ones I listed, are, I think, definitely signs that pelvic floor PT could be a route to go. So, for one, erectile dysfunction, something that a lot of my patients struggle with. And a lot of the times we rule out hormonal causes. So, we'll check testosterone and blood tests for prostate and things and make sure that everything's okay there. And there's psychological component to erectile dysfunction too. But for some people who try Cialis or get Viagra and it's just not working for them, it does make me kind of wonder, okay, would this person maybe benefit from pelvic floor PT? Is this really more of a mechanical issue where the muscles are too tight and we need to work on releasing them so that someone can have an erection? Kind of similarly, chronic prostatitis or prostate inflammation is relatively common condition and can cause a lot of urinary symptoms, so urinary frequency, burning with urination, pelvic pain, and that is another condition that I've had folks go to pelvic floor PT and really see a benefit. And then another really common one is after people are treated for hemorrhoids or if they have an anal fistula or an anal fissure and they need surgery, or even if they don't, and there's, a ton of inflammation or there's an infection in that area and things clear up, but then afterwards they continue to have pain with bowel movements or they continue to have pain with intercourse. And a lot of people just think, okay, this is just life after surgery, when really it's like, no, I think we could maybe fix this. So there's a lot of really common conditions that I think people think that they have to just live with when really there is therapy that could help a lot.
We see it all the time where people just assume they have to live with a certain condition. It might be pelvic floor, it might be shoulder, it might be their back. I
Hmm.
think just way too often we see people who just think that this is just what life has to be.
Yeah,
And so I like that message of it doesn't have to be that way.
right.
I think one thing I'd like to emphasize is one thing we talk about when it comes to busting myths about pelvic floor. You mentioned pelvic floor being tight. We often find people if they think pelvic floor, they think I need to strengthen it and I need to tighten it
Yeah.
more. But we find
No.
the vast majority of time it's already tight. So
Yeah.
now you're just trying to tighten something even more.
Yeah.
And so we work a ton on breathing and relaxation and just freedom of movement. So I like that you mentioned tightness because I think a lot of people they hear pelvic floor, so they think let me tighten more, and
Yeah.
that's usually just creating more of a problem.
I feel like for a long time, Kegel exercises were just the answer for anything
Yeah.
pelvic floor, and it turns out they're not. So they work for some things, but not for a lot of things. So yeah,
Pelvic floor therapy, no matter what gender, is a lot more than let's just do more Kegels.
yeah.
So if that's something that you think kind of is a misconception of there's nothing to do about it, what's something that you think we should be talking about more when it comes to either pelvic floor issues in men or just the LGBTQ population in general? Anything you think you wish people would be talking about more, whether it's patients, providers, both?
From the provider standpoint, I think, again, it's just more about knowing that pelvic floor PT is an option and a treatment modality that we can use. I think, as I was saying, for a lot of people, it's just not kind of on their radar. So I think having those conversations between providers, having continuing education. We do lectures once a week as part of our continuing education stuff, and I don't know if we've had a pelvic floor health lecture, certainly not recently. So I think there is a knowledge gap there amongst providers. And then for patients, I think what happens is a lot of the times, especially with my cis male patients, but also a lot of my trans patients, they'll have frequent like UTI esque symptoms, and we do urine tests and everything is negative, and they're still saying like, no, but I'm still having discomfort, I'm still having pain with urination, or I'm still going really frequently, or I'm still having issues controlling my bladder. And so wanting to kind of put it on patients' radars too, of like maybe this is a pelvic floor thing. And that's not really for the patient to figure out or know in advance. But I think the more that providers understand the ways that those symptoms can relate to pelvic floor health, the more we can present that as a resource for our patients.
I think that's a very common message I've heard in doing a lot of these interviews is, again, a lot of people think that recurring issue just means they have to deal with it.
Yeah.
What I find is it gets really frustrating as a patient to go to your third provider and you still don't have an answer. I don't even know if there's an answer to this, but any suggestions to the person that's seen 3 providers, 4 providers, still doesn't have an answer? And I don't blame them for saying, my problem can't be fixed.
Yeah. The first thing that popped into my mind, which is terrible, but, and I say this with a huge grain of salt, but Reddit forums are where a lot of my queer patients have gone to figure out what may be going on with them. And not just my queer patients. And, you could drive yourself crazy going down rabbit holes on Reddit about your symptoms and different conditions and things. So I'm not telling people to just go on there. But I think if you feel like there's something wrong and you haven't found an answer yet, I I do tell people like it's okay to trust your body and to continue to advocate for yourself. And unfortunately, sometimes that's what it takes. Sometimes you do have to see multiple people before someone finds an answer. And not everything in medicine has an answer. And that's kind of one of the really frustrating things for providers and patients. But I think that's where the importance of self advocacy really comes in. And yeah, so if you're not finding an answer, just trying to find an empathetic primary care physician, primary care, like I will sing its praises all day long. So having a connection with a primary care provider who knows you and can follow you longitudinally and be able to track what you're experiencing and be there as your sounding board so that when you hit dead ends, you can come back together and say, okay, you know what, like let's try this, or why don't I refer you to this person instead? So I guess all of that is to say it's a plug for primary care and having a doctor that you trust. So
Took the words right out of my mouth. As a physical therapist, it hurts my ego, but I can't fix everybody's knee pain. I can't fix
yeah,
everybody's shoulder pain.
yeah,
What I tell people if they're having trouble finding a provider is not every provider is going to have the answer. Like you said, I think that's a great message. But what's the interaction you're having with that provider? Even if they don't have the answer, are they supporting you? Are they giving you options? Are they trying
Yeah.
to help you down the right path? So even if it's not the right provider, like you said, having a primary care physician or physical therapist or whoever helping you along the way goes a long way. And you don't always
Yeah.
need to find somebody that has the answer. You do need to find somebody that will kind of be your guide along the way and be your sounding board. I like that sounding board analogy of, hey, I'm here to support you and work with you as a team rather than just tell you what to do.
Yeah. I completely agree.
I think that's great. So this has been awesome. So if you had to leave people with one message, or if you wish people knew one piece of health advice, what would that be?
Oh, that's so tough. And we have kind of covered this, but I was just thinking about this, and honestly, it's just asking for what you need. I think that I know I, as a provider, often depend on my patients to tell me what they're looking for, because someone may come in and have a whole list of symptoms, and at the end of the list, sometimes I'll just ask them, like, what are you worried that this could be? What do you think this could be? And every now and then someone will be like, well, that's why I came to you, which is totally fair. But sometimes they'll say, like, I'm really worried this is colon cancer, or I'm really worried I have MS, or something like that. And that kind of helps me be able to know, like, where is this person at mentally? What are they worried about? How can I help reassure them that's not what's going on? Or then order the appropriate tests to make sure that we're ruling out things that could be going on. So I think it's okay to go into your interactions with providers and to have in your mind, like, what am I worried about? What is it that I want from this visit? Because that helps us as providers too to be able to be more empathetic and to understand where you're coming from, and then it helps kind of guide our decision making too.
I think that's great. I think huge credit to you for even asking that question, being open to hearing that question. I think that's a perfect example of it shows that you're a provider that wants to work as a team with someone. You want to understand everything that's going on, and you're not just zeroed in on already what you think is going on. You want to know what they think is going on. So that's a huge credit to you.
Oh, thank you.
So this has been great, Will. So if people are looking for a primary care provider or even just want to find out more information, where can they find you?
Yeah, so if they just type in my name and type One Medical, my bio will come right up. I love all of my colleagues. Truthfully, I'm at the Thomas Circle office at 15th and M Northwest, and so all of us are great, but I'm also happy to see anyone that comes in. So,
That's great. Thanks so much for your time, Will.
yeah, thanks, Jesse. I appreciate it.